My name is Joanna Hussain and I'm here to talk to you about ADHD. What is attention deficit hyperactive disorder? ADHD defined. Federal government defines it as a condition included under the other health impairments category. ADHD is a common behavioral disorder that affects an estimate 8 to 10% of school-age children. Boys are about 3 times more likely than girls to be diagnosed with it, though it is not yet understood why. Kids with ADHD act without thinking, are hyperactive, and have trouble focusing. They may understand what's expected of them, but have trouble following through because they can't sit still, pay attention, or attend to detail. Of course, all kids, especially younger ones, act this way at times, particularly when they're anxious or excited. But the difference with ADHD is that symptoms are present over long periods of time and occur in different settings. They impair a child's ability to function socially, academically, and at home. The picture shows that children with ADHD have less activity in their brain areas while performing attention demanding problem solving skills. Characteristics of ADHD are as follows: impulsivity, which is marked by students who tend to blurt out responses before thinking about them, who tend to redirect topics of discussion, talk out of turn, and disrupt class learning. This trait explains why students are unable to focus on the relevant components of problems that need to be solved and why they often disrupt learning environments which ultimately cause poor responses from classmates and decreased acceptance. Hyperactivity is an impaired ability to sit or concentrate for long periods of time. This makes it very difficult to complete tasks and often disrupts other classmates as ADHD students are often tend to move around. Inattentiveness is the inability to pay attention, focus. This problem explains why many of these students have difficulty following teachers' directions and seem to be confused about where they're supposed to be and what they're supposed to be doing. This makes it hard for individuals to transition from one activity to the other. Difficulty sustaining attention to tasks may contribute to missing important details in assignments, daydreaming during lectures and other activities, and difficulty organizing assignments. How it affects our students. Students demonstrate a failure to understand and follow rules. Students are unable to complete required tasks. Students cause classroom disruption. This ultimately causes frequent lack of social interaction and poor academic performance. Students have also found that Studies have also found that students with ADHD compared to students without ADHD have persistent academic difficulties result that result in the following: lower average marks, more failed grades, more expulsions, increased dropout rates, and lower rate of college graduation. Assessing ADHD. Pre-referrals and proper full evaluations must be carried out for diagnosis. Multidimensional evaluations, which involve diagnostic interviews, medical examinations, behavioral rate scales, standardized testing, and observations are necessary. All these evaluations are necessary so that ADHD is not misdiagnosed, and so that early intervention can be implemented based on students' needs. Treating ADHD. Because prescription medications are widely used to assist in the management of hyperactivity, many parents of children with ADHD seek to help from doctors first. The chart shows the number of FDA-approved medications that can be prescribed for children with ADHD. Behavior modification plan. Parents and teachers can share information with one another if they work together to plan behavioral and academic strategies for the students. Parents can offer information about the children, including their medical history, hobbies, interests, effective reinforcers, and behaviors in other settings that may inform the decisions made by teachers and other members of the IEP team. The teachers can keep parents informed about their child's progress, performance, and behavior in school. Behavior therapy can be a beneficial part of treatment for ADHD. Common forms of behavior therapy for ADHD can include behavioral intervention, social skills training, parenting skills training, and so on. In addition to these therapies, parents can help improve their child's behaviors by setting and enforcing rules, maintaining a consistent schedule, and organizing everyday items such as clothing and school supplies. Remember to always be patient, do one thing at a time, and avoid negative approaches. The ADHD diet. Children with ADHD must eat to optimize their brain's performance. Using this ADHD diet, one can help any of the diet can help any of these treatments work better. But if you eat junk, none will work. Limiting sugars and increasing brain food such as bread, cereal, rice, pasta, vegetables, and fruit, children will begin to work more effectively and focus better. Strategies to use within a classroom. Differentiated instruction. Using tiered lessons for the same lesson to meet individuals' needs is necessary. Those with ADHD who are hyperactive can learn through structured lesson plans that involve tactile activities and movement. Behavior charts can also be utilized. Such things as visual red light, green light cue on a traffic light can be used to note behavior progress throughout the day. Students can see how they are doing based on this chart. A traffic light with clothespins and students' names can be used to show behavior. Students will start on green. As the day continues and behaviors disrupt other students and learning, the child will have to move their clothespin with his or her name onto the yellow light. If a child gets to the red light at the end of the day, he or she will have to write a letter home explaining why they got in trouble. Equipment can also be used within the classroom. Such equipment as seat cushions can help those with hyperactivity as their need to move will be fulfilled. Working in groups can help those with ADHD see how model behavior looks like. It can also increase social skills. Lastly, classroom layout is especially important. As teachers, we need to limit distractions. Therefore, placing a child with ADHD at the front of the classroom near your desk can help focus them, ground them, and ultimately help you bring them back to task when they are distracted. Lastly, making sure that their work area is clear of distractions is very important to keeping them on task. I hope this presentation has helped gain a little more insight on students with ADHD. Thank you. Good night.